Turn to the Mental Health Continuum in Chapter 1 of your IACT for Positive Mental Health and Wellbeing Course Manual Toolkit and Resource Pack. We can think of our well-being in terms of our sense of happiness, contentment, self-esteem, and general health. We all have well-being. Sometimes it's good and other times not so good. Think of your well-being on a scale of 1 to 10. 10 is a really positive well-being, and 0 is a really poor well-being. Where might you put yourself on this well-being scale now? Now consider the horizontal axis. This horizontal scale reflects the diagnosable mental illness. On the far right side of the scale would be someone with no diagnosable mental illness. On the far left-hand side of the scale would be someone with a more severe diagnosable mental illness. Consider Sam. Sam enjoys working in an office as a liaison officer, has lots of friends and family, likes keeping fit, and enjoys positive well-being. Sam will sometimes have a bad day, but generally Sam is able to bounce back. Sam does not have a mental illness and enjoys positive well-being. Therefore, Sam would be in the top right-hand corner of the continuum. Now consider Pat. Pat has a stressful job as a project coordinator in a busy office. Pat has lots of deadlines to meet and has a heavy workload. Pat does not feel like he's coping well at the moment. Pat is also moving house and is having childcare problems. This has often made Pat late for work and has added to Pat's stress levels. Pat does not have a mental illness. However, Pat's well-being is low, and Pat is not coping well. Therefore, Pat would be in the bottom right-hand corner of the continuum. This is Al. Al has recently separated from her long-term partner. At the moment, Al is also having problems at work, has a new boss, and there's a lot of change going on. Al was recently diagnosed with depression. Although people can and do recover from depression, Al has not yet got the right support and is still struggling. Al has a mental illness, and Al's well-being is low. Therefore, Al would be in the bottom left-hand corner of the continuum. This is Joe. Joe has a good job as an account manager and has worked at the organization for the last 7 years. Joe has a nice house, lots of friends and family, and enjoys gardening. 12 years ago, Joe was diagnosed with bipolar disorder, and now, with the right tools and support, Joe manages the bipolar disorder well, and so enjoys positive well-being. Although Joe has a mental illness, Joe has the right tools and support to manage his mental health issue effectively, so Joe enjoys positive well-being. Therefore, Joe would be in the top left-hand corner of the continuum. We all have mental health, and we all have well-being, and this is not something that stays static. It's something that changes, often in response to life events. Could it be that we all pedal around this continuum as we go through life?